So if it's a persisting cough, for example, if you are coughing once a day and that's one-off and doesn't happen again, I would just dismiss it maybe. Maybe it's just kind of a fluke basically. But if the cough is persistent for a couple of days and more than once a day and also unrelated, for example, to excitement or activity, and just happening in rest, then definitely I would take my dog to a veterinarian. A little bit dependent also on the age of the dog. So certain dog breeds are more prone to develop certain heart diseases, for example, valvular heart diseases. And with the progression of that disease and development of congestive heart failure in the worst case, then coughing is definitely a clinical sign. The problem is how to distinguish, is it, for example, a respiratory problem or collapsing trachea problem, or is it a heart problem? So in order to rule out all the things, we just have to run a couple of tests, unfortunately. There's no other way to just distinguish it without that. So number one is usually chest radiographs, because that helps you a lot to evaluate the lung tissue and also to look at the heart size. If then, for example, you also have a heart murmur, that is more suggestive then of valvular heart disease. So that would lead me then to the next step and saying, okay, the next thing we need is an echocardiogram, which is the ultrasound of the heart, because that tells me where's the murmur coming from, is the heart normal in size, are the valves abnormal, and that is kind of the way how to distinguish between, is it just a respiratory disease or heart disease related cough. Here in Hong Kong, the most common is chronic degenerative valve disease, and that's just because of the dog population. Here in Hong Kong, we have mostly small breed dogs, and that's basically the disease they're mostly prone to. In larger breed dogs, we can also find a condition that's called dilated cardiomyopathy. Basically, the heart becomes very, very enlarged and doesn't pump properly anymore. Especially with valvular heart disease, the correlation between the loudness of the murmur and the severity of the heart disease is not always there. If you have a heart murmur, it's always better to follow up with radiographs and echocardiogram in order to establish the heart disease, because especially with valvular heart disease also, there's certain stages of the disease. You have the clinical state and you have the subclinical state, meaning you have no symptoms. Within the no symptom stage, however, there are also different stages. One of the stages requires medications already, and the other one does not require medications. But in order to find out which stage you are in, you have to do the ultrasound. So apart from persistent cough, which is really a very severe sign, and they can also struggle to breathe, basically they really have to work very hard in order to get air into their lungs. Another clinical signs is definitely weakness and lethargy, and also fainting episodes, fainting being a more extreme clinical sign that definitely warrants veterinary attention right away.